Everybody's talking about health and wellness, turning over a new leaf. Let's talk about the men today with prostate health. Dr. David Yee, the Director of Urology at Sutter Health Roseville. Doc, welcome. We talked a little bit earlier. Men are not generally the best at staying ahead of some medical problems or even going to the doctor to begin with. How does this factor in with prostate health?
Thank you, Walt, for having me here to discuss prostate health. Really been a fan of your work.
Thank you.
Born and raised in Sacramento. But you're absolutely right. Prostate health is incredibly important in men. As we know, prostate cancer is the most common cancer in older men, and 1 in 8 men in America develop prostate cancer.
So do you talk to your parents, talk to your dad? Is it about family history when this first comes on your radar, or is there an age where you should start taking the PSA test?
Well, certainly family history plays a role in when we get the PSA blood test or the prostate-specific antigen blood test. But really, it's because prostate cancer is the most common cancer in men, we start prostate cancer screening typically at age 50. Usually the different organizations such as the American Urological Association recommend prostate cancer screening starting at age 50, typically to age 69, routine screening. However, if you do have a strong family history, or if you're African American, or if you have hereditary syndromes like BRCA or Lynch syndrome that predispose you to prostate cancer, we even recommend testing as early as age 40.
So former President Biden came out at age 83 saying that not only did he have prostate cancer, but it was a Gleason 9, and that's pretty serious at 83. And my reaction was, why haven't you been testing? I mean, 83 figure, and it's bad.
Yeah, absolutely. It was quite a shock, I think, to the American people when, former President Joe Biden announced that he had actually metastatic prostate cancer. I'm not overseeing his particular care, but, gleaning from the newspaper accounts, it sounds like he had stopped prostate cancer screening at age 71, which understandably follows many of the organization's different guidelines, where age 69 is typically when you stop routine screening. But certainly, we at Sutter Health encourage our patients, even if they are 70 years or older, if they're in good health and have a life expectancy of greater than 10 years, it certainly warrants a conversation to continue PSA screening. And it's quite a surprise that the former president did not get continued screening, seeing as how he's the president of the United States.
He's got good doctors there.
and
Walter Reed, right? I mean, he's got the best care in the world. But a lot of people are probably like him. He's more the norm, I think, with men, finding out late or too late. But is there an age where you may get it, and it doesn't matter at that point? I've heard people say something else will probably get you before this does.
That's correct. If you look at people's life expectancy, so for example, you can make a case in older men whose life expectancy is less than 10 years that maybe getting a routine PSA blood test may not be advantageous to them.
Right.
But certainly, like I said, if you're in good health and you have a life expectancy of over 10 years, you certainly should have that conversation with your patient. And we at Sutter Health, we do that.
You easily can go to Quest and schedule your blood work and do it. It's just like any other blood work. Quickly, bladder and kidney.
Bladder cancer is the 4th most common cancer in men, and it's something that we don't routinely screen for, but typically symptoms are what we call gross hematuria, or visible blood in the urine. That typically will trigger a workup. We'll do an evaluation of someone's bladder, and we'll look inside their bladder with a camera scope, and that's how we usually diagnose bladder cancer.
All right, Dr. David Yee, nice to see you, doctor. Appreciate the tips today.
Thank you, Walt. It's a real pleasure.
Thank you.